supplies, we visited 9 in the month of March. And we also checked them for chlorine residual. Of the samples analyzed, 22% showed negative chlorine residual. So we're asking that you make a special effort to make sure these waters are properly treated.
Bless up, baby, our family and viewers. Welcome back to the channel. It's your girl, Isabel Rose. And in this one, Public Health Inspector blows the whistle on contaminated water. Spoke of recent testing of March and the results, as well as NWC staff sick out and the People's National Party opposition spokesperson on water, Ian Ailes, calls on the government to do something about it, immediate, effective. Stay tuned for the details at hand. Don't forget to like, share, and subscribe to the channel. So ABR family, just a quick update on the whole water saga that has been making its round in social media. We've seen where Jesse James Clarke had blown the whistle, letting our Jamaican people know that the water is indeed contaminated, and there's sometimes in areas 5 times the level that is required, that is safe. However, we see in the government members, senators, councillors coming out at Jesse James Clarke, playing politics with our health, playing politics with our water. And so now they came out and they said that the water at NWC was safe. Now we're hearing from public health inspectors who are inspecting our water, and they have blown the whistle in the St. Catherine area, saying samples recently tested since last month has indeed contaminants in them. And I want you to hear this in this audio.
Found the presence of bacteria. Ms. Brown was speaking at last Thursday's meeting of the Public Health and Sanitation Committee of the St. Catherine Municipal Corporation. She said the Chief Public Health Inspector, Dr. Francie Prosper-Chen, was requesting an urgent meeting with Committee Chairman Sidney Rose to discuss the issue.
We take note that most times the water supply is not adequately treated, and therefore we're having a bacteriological count, and it is bringing down the parish average.
Ms. Brown outlined the findings of tests conducted last month by the Health Department of water supplied by the Municipal Corporation and the National Water Commission.
For the municipal supplies, we visited 9 in the month of March. And we also checked them for chlorine residual. Of the samples analyzed, 22% showed negative chlorine residual. So we're asking that you make a special effort to make sure these waters are properly treated. For NWC, we visited 28 supplies, and we did 28 tests, and 1 was negative for chlorine residual.
Acting Deputy Public Health Inspector for St. Catherine, Judith Brown. Chlorine residual refers to the amount of chlorine remaining in water after it has been treated. And the St. Catherine Health Department says it has been unable to keep track of the number of water bottling stores which have sprung up over the parish. The Health Department has sought the assistance of the Municipal Corporation in this regard. Acting Deputy Public Health Inspector for St. Catherine, Judith Brown, also announced a change to the licensing of water trucks.
The number of water bottling stores we are concerned in the last 2 years, we have moved from 9 to 32. We want the council to help us to identify them so that we can better monitor them. Also, one of the strategic plans that we have for 2025 is that the water trucks will be licensed as food establishments.
Acting Deputy Public Health Inspector for St. Catherine, Judith Brown.
And so having heard all of that, are they going to come out now and say it is a lie? Are they going to come out now indeed and tell our people to boil the water? The public health inspectors even wants trucks to meet the requirement in taking water, in trucking water to people. There's a breakdown in the whole processing and getting the water purified. The public health inspector have spoken And so we know also that one of the process for, treating our water is the whole process of chlorination. And we heard from the public health inspector that they did testing of 28 samples and one of them came up with no chlorination, with no chlorine. And so what are they using to treat our water? Many more questions than answers. We're seeing also now circulating in the media space where the NWC staff, some of them, are basically on sick out. A whole heap of discrepancies with their pay, and they have taken action against the government. And the minister responsible for water, Matthew Samuda, spoke out, and he's coming again to say that the water is safe for drinking, and that is a small handful of persons, taking action. Whether it is small or the entire, the people them want their money, same like how the politicians them get them money. The people them want their money. And so with them being out, persons were questioning too what will happen with the quality of the water that's already in shambles. But hear from him, and then you're going to hear from Ian Ailes, the opposition spokesperson on water.
So I am aware of disruption in the maintenance department at the National Water Commission. But I want to assure the public that this is not sanctioned industrial action. We've worked very hard over the last 4 years to bring industrial harmony to the National Water Commission. I've spoken with the heads of unions. I have gotten direct feedback as to what the issues are. I understand that this is a small group of employees who are particularly upset about the band that they have been placed in post reclassification exercise. I would say to them that the process is ongoing, a process that was signed off on with the unions, with the Board of the Water Commission, with the Ministry of Finance, after we received what's dubbed the McAnuff report. The McAnuff report was a report I commissioned after the strike of 2022, where we said there was obviously industrial disharmony and we needed a roadmap to fixing same. We have gotten that roadmap. We've gotten all stakeholders to sign off, and let's allow the process to work. The action being taken now is not in good order. It does breach the employment rules related to said employees, and we hope good sense will prevail in the shortest possible time. But I do want to address one area that I think the public needs to be aware of. The reclassification exercise, we're not perfect, saw the wage bill at the Water Commission increasing by over $400 million monthly, meaning we pay over in excess of 10% of total revenue as increases in staff costs to our hard-working men and women of the Water Commission. So I don't want the impression in the public to be that we are not working with our employees. In fact, we are working very hard to ensure that there is indeed industrial harm. And this is an unfortunate incident, and we encourage those involved to work through the process. As a process exists, a process is working and was agreed on by all stakeholders. There is one element, however, of returned political mischief as it relates to water quality. I have heard rumors where persons were saying, well, if the maintenance team is not working, what of the water quality? That's not the unit that deals with water production. There's actually a water production unit where there is no industrial disharmony. So I assure the public, as we have done in the past, National Water Commission water is indeed safe for drinking, and we encourage you to enjoy your Water Commission water.
I am calling on Prime Minister Andrew Holness to intervene in the ongoing sick-out by the maintenance workers in the engineering department at the National Water Commission. The affected department is responsible for several critical functions, including the chlorination of water and the repair of water main breaks nationwide. With workers now off the job due to dissatisfaction with the outcomes of the recent public sector compensation review, I am sounding the alarm about the potential risk to public health and water safety. These workers play a vital role in ensuring that our water supply is safe and reliable. Chlorination is not optional. It is not an option. It is essential. Any disruption in this service compromises the safety of water reaching Jamaican households. I acknowledge the recent verbal comments made by the minister with responsibility for water, but insisted that the seriousness of the situation called for a more direct and a high-level response. This is not the time for platitudes. We need the Prime Minister to step in and take the matter seriously. The safety of the public water supply cannot be treated lightly. I also want to raise the concern about the fairness of the compensation review. If the government got it right for the members of parliament, I want to repeat, if the government got it right for the members of parliament, why couldn't they get it right for these frontline workers who are now so critical to the well-being of the Jamaican people, I ask. I am calling for urgent dialogue between the government and the affected workers. We cannot afford to have this kind of breakdown in the water sector when the NWC already is struggling to meet the needs of the public. The Prime Minister must intervene now for the safety of the Jamaican people and the integrity of our water system.
ABR family, wanna weigh in? Let us continue this discussion in the comment section. Me wanna say, don't forget to like, share, and subscribe to the channel on the road to 30K and beyond. Help me to get there, family. Share this video. Get this video to at least 6,000 likes. Stay tuned for more videos. Stay tuned for more updates. Big up on yourself.